From KVUE News in Austin, you're watching Texas This Week with Ashley Goodo.
Good Sunday morning. A Texas congressman is calling out Governor Greg Abbott and the state for its backlog of SNAP applications. We sit down with U.S. Representative Lloyd Doggett in just a minute, but first, let's get to the 3 things you need to know in Texas politics. On Friday, the U.S. Supreme Court ruled 8-1 that people accused of domestic violence can be banned from owning firearms. The decision comes after a Texas man claimed the practice was unconstitutional. The justices wrote, quote, "Since the founding, the nation's firearm laws have included regulations to stop individuals who threaten physical harm to others from misusing firearms. The right to keep and bear arms is among the fundamental rights necessary to our system of ordered liberty. That right, however, is not unlimited." The Texas Medical Board unanimously approved new guidelines aimed at helping doctors to determine when they can legally perform abortions in the state. In Texas, abortions are banned unless a woman's life is in danger or she is at risk of losing a major bodily function. Multiple women have sued the state, saying they were denied abortions despite facing dangerous complications. The guidance does not include a list of complications where abortion will be legal, as some had hoped. Board members say there are some things they just don't have the authority to address, but they wanted to make one point clear. Doctors don't have to wait until a patient is in, quote, imminent harm to act. More than 2 years after the mass shooting at Robb Elementary, the Uvalde Police Department is changing its active shooter protocol. The new policy lays out 3 phases to active attack response. 1, stop the killing, ideally in 5 to 7 minutes. 2, stop the dying, meaning getting people who were hurt to care as quickly as possible. And 3, create a unified command when senior leadership arrives on scene to coordinate with other responding agencies. Other parts of the policy speak directly to the failed police response when officers waited in a hallway for 77 minutes before engaging the school shooter, including stating in the policy that a responder's protection comes primarily from effective fire, not from hiding behind hard cover. Some of the most vulnerable families in Texas don't have access to the federal programs that would give them help putting healthy food on the table and to be able to see a doctor. Austin Congressman Lloyd Doggett says the state is partly to blame due to clerical errors and a significant application backlog. He joined me to talk about the problems. You know, for almost a year now, you've been ringing an alarm about what's going on in Texas with SNAP and Medicaid benefits. Talk to us about what's going on.
Sure. Well, my concern is the genuine indifference of the Abbott administration to the needs of some of our disadvantaged Texans, people that are really struggling to work into the middle class, that need access to food, have food on the table for their families, and need access to a family physician and vital prescriptions. During the pandemic, the federal government provided an additional level of support to the state to keep people on Medicaid so they could get access to a family physician. And when that period ended, the state had the ability to review the applications of people to see if they should remain on Medicaid access, or they perhaps had gotten a better job or earning more money and no longer eligible. Texas has very strict eligibility requirements. Over the course of that so-called unwinding period, about 2 million people, 2.1 million people, were removed from access to Medicaid. Many of those people didn't find out they'd been removed until they went to see the doctor or they went to fill a prescription for a child. And of that 2.1 million, almost 1.5 million of those were through no fault of the person who was getting the Medicaid. They were the result of errors made by the Abbott administration in the Health and Human Services Commission. A variety of reasons why that occurred, some of them computer related, understaffed and the like, but those are people that lost access to their physician, and the agency simply has not moved promptly to take care of that and to correct the problems. We would not have known about some of this loss but for courageous whistleblowers who I still can't identify, but that have been out in the agency that reported the failings that were occurring. At the same time, this same agency has responsibility for SNAP, the Supplemental Nutrition Program that many Texans rely on to get food on the children for their children. And they're running way behind on that program. I just feel there should be better administration, better caring, and that there's so much more the state could do to fulfill its responsibilities to deliver federally paid assistance to people so that they stay healthy and well fed.
I really want to pause on the SNAP part for just a moment, because when we say they're running way behind, we're talking months. You generally have a 30-day period to approve a family for SNAP.
Precisely.
And it's taking significantly longer.
You know, in May of this year, they reported they still had applications from last August. That's how far behind. And they've been out of compliance now for years, not for months. And there's just no excuse for that. This state has ample resources, an overflowing rainy day fund. If it's a lack of adequate staff members, which I think is one of the problems, then they should deploy additional staff. This same agency has had its employees on mandatory overtime now for about 3 years. And so it's understandable that those employees feel a little overwhelmed out there. I think there's a need for a management change. And there's a need for the governor to accept some personal responsibility for this. This is his administration. With reference to the SNAP program, I think there have been recommendations to the governor that they simply review for eligibility every year instead of every 6 months. That would lower the burden of reviewing applications. He's not approved that. There have been very little comment out of the governor's office on this program for which he is responsible and which this agency is defaulting on.
I want to point out the state had to give a response, and in its latest response, it said that it expects to, quote, achieve full compliance by September of 2025.
And I find that to be really amazing. Here is an agency that has removed people from access to a family physician, that can't provide prompt review of applications for people that are hungry. And it says the best it can do after all this time is that about a year and 3 or 4 months from now, it will be in compliance. That is not sufficient. And that's one of the reasons that I've continued to urge the Biden administration to be a little more forceful in dealing with the state of Texas and to suspend some of the federal assistance that comes here for administration, shift that to the state, or engage in whatever other sanctions they can do, because the state's not complying. The state of Texas, the Abbott administration, receives over $1 billion of federal taxpayer money every year to administer the Medicaid program. And this is the result we get, people thrown off. And in addition, when someone who's been removed, perhaps because the computer didn't get them right, they didn't get the right information, and we know in May there were still a number of these people out there, they have to go back and reapply. And when they reapply, they have huge backlogs again. This may be someone who has a sick child who's desperate to get them assistance. They didn't know they were denied this coverage because they didn't do anything wrong. It was all the state and Abbott administration problem. And now they have additional delay of weeks, months before they get the opportunity to access that federal Medicaid assistance again. So this is a broken system. It needs repair. It needs new management. It needs some changes like moving to annual rather than 6-month certification, and some reinforcements for those overworked employees out there to get the job done and get people the assistance they need to not for a handout, but for a hand up to help them continue to climb. We know there are many workforce shortages across our state in everything from restaurants and construction to high tech. And many of these folks with a little bit of support can stay healthy and working and supporting their families.
I reached out to the governor's office and Texas Health and Human Services Commission about the backlog. I did not hear back from the governor's office. HHSC leaders said they did not have anyone available for an interview, but they did give me a statement that reads in part, quote, "The Texas Health and Human Services Commission is taking all possible actions to provide benefits to eligible Texans as quickly as possible. HHSC is also working with our federal partners to implement immediate strategies to reduce the number of SNAP and Medicaid applications in the queue and ensure that the redetermination process operates as smoothly as possible." That's Texas This Week.